That's what I like to say.
No, you're not drinking coffee. I'm still coffee. I'm like, you must be drinking coffee.
Yeah.
It's great to see you.
Good to see you
I
as well.
still pop up once in a while on our video.
You too.
The first class stuff.
It's going.
Did I have a good beer?
Good evening, everyone, and thank you for coming for the first Flavor Art Budget. Today is Wednesday, August 29th, 2018. It is 6:01. I'd like to bring the first public hearing on Central Health's fiscal year 2019 proposed tax rate. Before I call the first item of business, I'd like to welcome everyone who has joined us and explain the order of this evening's public hearing. The public hearing will begin with a brief presentation on the fiscal year 2019 proposed budget and tax rate. At the conclusion of this presentation, Yvonne Davila will read the guidelines governing the public comment portion of the hearing, and I will recognize members of the public who have signed up to speak. Each speaker will have no more than 3 minutes to address the board. When the 3 minutes have elapsed, I will ask the speaker to finish his or her sentence to ensure that the next member of the public has an opportunity to speak. Thank you. With that, agenda item 1 is present an overview of the Central Health proposed fiscal year 2019 budget and its associated tax rate, and receive public comment concerning the proposed budget and tax rate. Mr. Canola will be presenting. The length of his presentation is estimated at 10 minutes. Thank you, Mr. Canola.
Thank you, Chair Zamora, and I'll try to make it quick. This is a brief presentation related to the Central Health fiscal year 2019 proposed budget and the property tax rate associated with that budget. This budget has been prepared for fiscal year 2019 in support of our strategic work plan. You see the 3 objectives up on the screen: developing and executing healthcare delivery strategy based on people in place, implementing patient-focused and coordinated healthcare system, and implementing sustainable financial model for healthcare delivery system strategies through 2024. The fiscal year 2019 proposed budget tax rate is prepared at a tax rate of 6% over the effective rate. On the left-hand side, you see what the actual tax rate at the 6% over the effective rate is. There are 2 pieces of the tax rate: a maintenance and operations piece, and then a small portion of debt service. A total rate of you can't see it there. It's 10.5221 cents is the total rate. On the right-hand side, you see some information related to the average taxable homestead value. We always look at the prior year and the current year. See the average taxable homestead value in fiscal year 2019 and the proposed tax rate with a tax bill of $343.97. The impact to taxpayer at these values represents a 4.8% increase at this average taxable homestead value. And then the actual rate, the tax rate, has decreased 2% from 10.7385 cents to 10.5221 cents. And then just as a quick reminder, Central Health has a homestead exemption, which is 20%, which is the maximum allowable by state law. And then this year, for fiscal year 19, the Central Health Board of Managers has approved an increase of the over 65 and disability homestead exemptions from $80,000 to $85,500. Just a quick look at our budget. This is a summary: sources and uses. On the right-hand side, you see the fiscal year 2019 proposed budget. You see the up at the top under property taxes, our property tax rate, which again is 6% over the effective rate. at $196.9 million. Our healthcare delivery program has increased by approximately $8.1 million from fiscal year 18. A couple of the major components of that budget are intergovernmental transfers, which are approximately $139.1 million. A member payment to the Community Care Collaborative of $34 million. And funding for Sendero, our HMO, for risk-based capital for calendar year 18. And just to pause for a second, Sendero is on a calendar year basis. And so for fiscal year 19, we're budgeting for that calendar year 18 risk-based capital estimate. And I'll reiterate that that's an estimate in our budget. The estimate for 2019, for fiscal year 2019, on the central health budget is $20 million. Also included in fiscal year 19 is our Eastern Travis County Service Expansion Initiative. There are a couple of timelines that have been listed on this slide related to where we're currently at. We'll continue community stakeholder engagement for the fourth quarter of fiscal year 2018. Again, this is where we're at. As we move into 2019, we will begin developing business plans for service sites. We plan on requesting approval for debt issuance associated with expansion on those sites, which will require both the Central Health Board of Managers and the Travis County Commissioners' approval, which we also are planning to go in the first quarter of 2019. And then in addition to that, developing our mobile clinic, both acquisition and service delivery strategies by the second quarter of 2019, and having services begun at that point. So next steps, this is a long list of the meetings we've had. We're currently at our August 29th meeting, which is our first public hearing. We also have a second public hearing scheduled on September 5th at 5:30 here at Central Health. And for additional information related to our fiscal year 19 proposed budget, you can visit www.centralhealth.net, and there should be some information on that page. On the finance page, we'll have both historical budgets and fiscal year 2019 budgets. So thank you for the opportunity to do a brief presentation prior to the hearing.
Thanks, Bill. We have now reached the time to receive public comments on the proposed fiscal year 2019 budget and tax rate. Mr. Ivan Davida will read the guidelines for the public hearing. Mr. Davida.
Thank you, Dr. Zamora. For the purposes of citizens' communications and public hearings conducted by the Board of Managers, the following guidelines apply. Number one, any person may speak during A, the citizens' communication portion of any Central Health Board of Managers meeting at which citizens' communication appears on the agenda, or B, any public hearing that is conducted by the Central Health Board of Managers. Number two, in advance of speaking, an individual must complete a sign-in sheet that includes the person's name, address, and group being represented, if applicable. The individual must also provide a brief description of the topic or matter on which the individual intends to speak, if the topic or matter does not relate to an item on the agenda. At the individual's option, he or she may provide a telephone number and email address as well. Number three, the chairperson will call individuals to speak in the order in which they are listed on the sign-in sheet. Number four, each individual has a limit of 3 minutes. Number five, each individual may address the board only one time during any particular citizens' communication or the particular public hearing. Number six, an individual may not donate his or her 3 minutes or any part thereof to another individual who desires to speak. Number seven, an individual does not have the right to speak if he or she signs in after citizens' communication or the public hearing is closed. Public hearings will be closed once the last individual who has signed in has spoken. Number 8, depending on the number of individuals wishing to speak, the chairperson may, in his or her discretion, impose additional procedural guidelines on the time and/or manner of speakers' presentations to ensure the efficient and orderly conduct of the meeting. Due to the restrictive nature of the Open Meetings Act, the board is restricted from discussing any item that is not included or posted as an item involving discussion on the meeting agenda. For this reason, citizens' communication is usually a one-way communication vehicle. Thank you.
Thank you, Mr. Dagna. With that, I'm going to start reading the people who signed in and the number, the way they came in. And it gives me great pleasure to present the very first one, who's Brooke Wagon, who's a third-year medical student at Dell Medical School. She's actually my own medical student. Thank you, Ms. Wagon. Thank you, Ms. Wagon. Soon to be Dr. Wagon.
Soon. 2 more years. So thank you, Central Health Board and fellow Austinites, for allowing me to tell you a little bit about my passion for my neighbors and our city, and how I believe Dell Medical School will be contributing to our community in the years to come. My very non-traditional track to medical school was inspired by many things, but prime among them was my desire to work in and for our neighborhood. I live in East Austin. We are raising our children in East Austin, and I spent years as a Meals on Wheels delivery person with my kids in tow, seeing firsthand some of the challenges that our neighbors face. I believe working on health disparities and community challenges takes a lot of great minds, common intent, and a deep commitment to service and place. While the medical school I attend is new, I look forward to a day when we Austinites sit down and tell stories about how our community across healthcare, housing, politics, and neighborhoods came together to meet needs. In that vein, I'm going to be spending the next 9 months interviewing and researching the experiences of older folks, my neighbors, aging in place in public housing here in Austin. I'm working alongside the Housing Authority and hope to continue this work beyond learning and into interventions that directly affect the community, health, and well-being of my neighbors. But first, I have to have more understanding because their stories are theirs to share, and I will have the incredible opportunity of hearing them and learning from them. There are so many things one could ask questions about in a whole year of research, but I'm spending a year of my medical education in this way so that we might be able to do something about it. This year is titled Innovation, Research, and Discovery, and it's the only year like it at any medical school anywhere in America. I mention this because it serves a purpose in this context. Dell Medical School, and me as one of its students, is extremely cognizant of its commitment to this community in which it exists. We have been tasked with innovating in a way that matters and working to solve population health problems and with real impact on real people. What I'm studying isn't theoretical. It affects me, my family, and those I care about, live near, and serve in many contexts, not just medicine. I plan to be a primary care doctor in my neighborhood. This has been my plan since I started my application to medical school, and I applied only to Dell Medical School. The more school I complete, the more excited I am about how many wonderful people I'll get to work alongside as I stay in Austin. I already work with a wonderful primary care doctor a few blocks from my house as a part of my medical education. He and others like him, physicians who are integrally involved in the work of Central Health, are not the only piece of the puzzle in helping Austinites with health disparities have better outcomes, but they are definitely a piece. I am very privileged to have been accepted into the inaugural class at Dell Med, and I hope my story and perspective help shed light on why our medical school's mission will be transformative for Austin. Thank you.
Thank you, Ms. Wagner. And I hope someday you'll be sitting in this chair. Mr. Leonard Edwards, also a student from the Dell.
Hi, everybody. I'm Leonard Edwards, a third-year MD MBA student at the Dell Medical School and a previous Central Health alum. I was a program coordinator on the Health Equity Policy Council here before I started at Dell Med. For 4 reasons: the mission of a vital, inclusive health ecosystem, the innovation spirit that's built into the school and to the curriculum, and the community mandate. I thought it was a big differentiator that this school had the voters of Travis County vote to raise property taxes to fund our medical school. Feels like a kind of like an old-fashioned community barn raising. And Dell Medical School students are involved in the community in various ways. You heard from Brooke about her project coming up this year, ranging everything from being involved there to being involved in the redesign of the Austin State Hospital, and something that I'm very passionate about, our student-run free clinic downtown, and that's what I'm here to talk about today. So I've been volunteering at C.D. Doyle Clinic, this Dell Medical School student-run free clinic for the homeless, for about 4.5 years. We're a truly multidisciplinary clinic. We have students from University of Texas undergrad, students from the School of Nursing, Dell Medical School students, of course, and from the School of Social Work. We take anybody regardless of status, ability to pay, identification, or payment. We don't take, we are a free clinic, so we take no payment. We serve urgent care needs, and we are a foot back in the door for a population that has a deep distrust for our medical system. We're open for about 3 hours every Sunday at St. David's Church across from Arch downtown. We see about 15 patients every Sunday with about 20 volunteers. 45% of our patients are return, and 85% of our patients are homeless. And I wanted to tell you a story about Mr. R. And I met Mr. R about 4 years ago, and when I met him, he was very sick. He was jaundiced, didn't have any teeth, and was very unwilling to share his story with me or anybody else at clinic. And it wasn't until about a year later that I spent an hour with him after clinic on the sidewalk talking about his experiences on the street and really weeping with him about all the things that he had gone through. And it wasn't until we had that connection that he really had the trust in me and our clinic to really serve his needs. And gaining that trust helped him to engage in his health. And he's on his way to being treated for Hep C, and he has new teeth. And these are just some of the many stories that Dell Medical School students can tell you about being involved in the community. And I urge you to find out more about the ways we can be involved. Thank you.
Thank you, Mr. Edwards. Next is Carol Miser of Planned Parenthood. Carol?
Big enough that it didn't require me to wear my reading glasses. So. Hi, my name is Carol Meisel, and I am a 41-year resident of Travis County. I'm here to speak to you today on behalf of Planned Parenthood. I started my career as a nurse in public health, but then spent most of my career in the healthcare claims administration sector here in Austin. But really, I'm here to voice my support for your budget, your 2019 budget, but especially the funds being provided to both Planned Parenthood and all women's health care services. Really just to thank you for that, because helping Central Texas women help Central Texas families, help Central Texas children. I'm fortunate to have health care coverage. I've always had it, but so many of our residents don't. And I have friends who use your clinics, and that is their care. And there are many folks right on the edge of falling over a cliff. That also, to me, as a nurse, a healthy community is essential. And as from my perspective, is healthcare is both a human right and a civil right. And it makes practical sense. It's cost effective. If you prevent disease, you save money. So it saves money for clients. It saves money for the government that has to pay for those services. Basic preventative care is just essential to ongoing healthy community. The reality is Texas has not made women's health care a priority, which makes it even more important that you have made that a priority for our community. You continue to make an incredible impact on women's lives, families' lives. And so I just want to thank you for your ongoing commitment and hope you will continue to support it. And bottom line is we need to be a society that cares for each other. And I think your organization exemplifies that approach. Thank you.
Thank you, Ms. Meisel. Our next speaker is Saul Gonzalez, Planned Parenthood of Greater Texas.
Good evening. I want to thank you for the opportunity to address you today. My name is Saul Gonzalez, and I am a proud member of the governing board of the Planned Parenthood of Greater Texas. I'm also excited because this year I was a Central Health champion, and I've learned so much about, I've lived here the whole time since '82, and I saw the birth of it, and Dell Medical School, and it's great to hear from the folks that a lot of that work is now showing the returns, and the future is hopeful, more hopeful with Central Health. I do want to thank you for supporting Planned Parenthood. The underserved communities has always been an issue for me. Back in the 80s, I did a lot of organizing in the Latino community here with Informe SIDA, which was a project of the Austin Latino Lesbian and Gay Organization at a time when the disparities of HIV was prominent in the Latino and African American communities, communities of color, people who did not have the resources or health care to go anywhere and get the help they needed. I've worked for the American Cancer Society's National Cancer Information Center for 18 years. So healthcare, the disparities that we see there, access to healthcare when you have a serious diagnosis, lack of being able to get to your appointments when you're sick, big issue in the lower underserved communities. So I do want to thank you for being a partner with us. Planned Parenthood, we serve a lot of underserved. The grants that you provide us give those people access to the health care they may not be able to get elsewhere. We're sort of under attack, and you know that we're facing our state and national crisis in health care, and they want to disenfranchise the poor. And it's a great thing to see that Central Health is there, a government agency. We live in a great city. And a great community that has stepped forward to do these things. You provide help with our IUDs, which are scientifically proven that this is a way, the best contraception available. They're very expensive, and so the access that the folks that choose that as an option has been crucial. I believe in science, and I believe truth is truth. And so I do want to thank you. Thank you for standing with us. That partnership is invaluable. I appreciate y'all. You have a good evening.
Thank you, Mr. Gonzalez. Our next speaker is Robbie Osley from Planned Parenthood. Thank you, sir.
Hello, my name is Robbie Osley, and my husband Tom and I have lived in the Austin community for 53 years and raised our 4 children here. We've been blessed to have the resources that provided our family with access to quality health care. However, I'm reminded of the advice my mother gave my 3 brothers and me as we were growing up. You have been blessed. Now you are called to be a blessing to others. Central Health continues to be a blessing to those in our community who do not have access to quality health care. And I thank each of you for serving on the Board of Managers and volunteering your time, expertise, and commitment to the Travis County community. I am here as both a Travis County resident and a supporter and advocate for Planned Parenthood and for access to women's health care. When the 2011 Texas legislature eliminated funding for health care at Planned Parenthood health centers, many low-income women and uninsured Texas women lost access to basic health care screenings and birth control across this state, but not in Travis County, because Central Health's board and staff's leadership have prioritized the importance of family planning and women's health care services through the Central Health budget each year. And again this year, in the 2019 budget, through funding for basic preventive health care exams that include cancer screenings, FDA-approved birth control methods, testing and treatment of STDs, and much more. Texas continues to earn poor grades for access to women's health care. For example, the Center for Public Policy Priorities has published a series of reports that track the challenges low-income women face accessing basic health care and family planning services. Without the state's commitment to these services, it makes Central Health's commitment to women's health more important than ever. As a former board member of Planned Parenthood, I know how important access to women's health care is for the woman and her family. Tom bought me a little plaque many years ago that's hung in our kitchen. If mama ain't happy, nobody's happy. I think that quote could be tweaked to read, if mama ain't healthy, then nobody in the family's healthy. For many women, their visit to a healthcare provider for birth control is an opportunity for preventive health screenings. And that is why Central Health makes such a positive difference in the lives of Travis County women and their families. Thank you for your leadership and your commitment to women's health as reflected in the 2019 budget.
Thank you, Ms. Osley. Our next speaker will be Sarah Wheat, Planned Parenthood. Thank you, Sarah.
Hi, thank you so much. I really appreciate you all being here tonight. My name is Sarah Wheat, and my husband, my 3 kids, and I are proud residents of Travis County, proud to be taxpayers supporting Central Health, and I'm here in my role as Vice President for Community Affairs at Planned Parenthood locally. So I too am following and some of the echoing what you've heard a little bit earlier, and I just want to again express our appreciation on behalf of our patients for the life-saving health care that our patients have been able to receive thanks to Central Health making women's health such a priority. I know you all are more familiar than most with where Texas ranks on so many health indicators, and unfortunately when you look at various women's health measurements, we are always among one of the lowest ranking states in so many different metrics. And so it is the commitment that you all have shown to address that here locally that has enabled so many of our patients to access the health care that they need. In particular, I want to mention one aspect of the program that you all have made a tremendous difference, and that is for many women, even though they might choose a particular birth control method that's right for them based on their life, their goals, their health, often it is their economic situation that actually determines what birth control method they're going to choose. And due to our incredible partnership with Central Health, we've been able to greatly make the playing field equitable for women coming into our health centers. Through that, we've had more women have had the option of choosing IUDs and implants, which are so effective at preventing unintended pregnancies. And to date, this year, we have served more than 3,000 women who've been able to access healthcare services at our health centers because of Central Health support. So I just want to again add to the appreciation you've heard tonight. It is not true in every community where we have such a strong partner and see the health of women valued so much. And so we just want to thank you again for your continued support.
Thank you, Ms. Wheatley. Our next speaker is Heather Alden.
Good evening, everyone. My name is Heather Alden. I'm the director of the Sims Foundation. We provide mental health and substance use recovery services to Austin musicians, music industry professionals, and their family members. We've been around for 23 years, and for a large part of that time, Central Health has been funding our services, and I'm simply here to express my gratitude and thank you all for believing in the model that we work in our community. We're able to access services through partnerships, paying a reduced fee for our services, typically a third of what you would pay normally. We're able to negotiate. So we're a bargain, and I think that the services that we provide are the highest level and come with case management and a high-touch customer service aspect. We could not do this without Central Health. We experienced in 2017 a very difficult change to the number of clients that we serve. We doubled the number of clients seeking substance use services in 1 year. A third of those were seeking services for opioids, and 60% of them were dually diagnosed with a mental health issue. It was a severe stress on our finances, and I went to the mayor and to various funders, and I'm proud to say that we're back on track. But when I sat down with Mr. Giesland, he showed his commitment to this issue, that we have a national epidemic on our doorstep. The musicians are a canary in the coal mine to what is happening all around us. And, we were able to get additional funding from Central Health at that time, and it has truly made the difference in the lives of many of our clients. So thank you very much. We also greatly benefit from the Sendero Premium Assistance Program. And I know this year, because of the increase in costs, we're going to have fewer people accessing the Premium Assistance Program. And we know that we're going to be taking back a portion of those clients that we had were able to serve through Sendero, but we're prepared for that, and we know that they deserve the best services they can get, and we're here to deliver. Oh, gosh. All right. Well, anyway, I just thank you very much, and thank you for the great community conversations that you had for your strategic plan. They were really run, and I appreciated being part of that. So thank you all.
Thank you, Ms. Alden. Next speaker is Ian Keenley. Bridget? Bridget?
Yeah, very good.
With Planned Parenthood. Thank you, Mr. Bridget.
Hi, thank you. My name is Ian Kili-Verja. I'm a volunteer with Planned Parenthood, and I wanted to first off thank you for the opportunity to speak at your board meeting. I am a prospective medical student myself. Hopefully Dell will be one of the schools I get to go to. And I meet so many individuals. Not only am I a prospective medical student, but I also guide other prospective medical students in their applications through Kaplan, as well as in my last job I was working with a scribing company. So I was guiding many students, many of whom are brilliant individuals who, as individuals, want to go into medicine in order to help their community or other communities that are less represented in healthcare today. And it wasn't until moving here to Austin that I started to see that in the government as well. So as somebody who was living in San Antonio previously and working with their Planned Parenthood, I've recently moved here to Austin back in April, and it's incredibly refreshing to see a board of people who work in the healthcare community, are doctors, some of you, who all believe in science as much as many of us prospective students do. And as somebody who's a youngish future doctor, currently trying to apply to medical school and hoping to become somebody who's able to stand for that same research-driven approach, it's really refreshing to see this at a time where I don't think support for science, fact, and healthcare has been lower in my lifetime. So I really appreciate this, and I really appreciate everything you've done for Planned Parenthood. Every bit of money that you're able to give to there, I think it's the first time I see a government body really showing support, not just for healthcare in general, but healthcare to the people who need it most. It's on your wall, and it's the reason that I'm even volunteering with Planned Parenthood. It's why I got started. So thank you.
Thank you, Mr. Ruett. Thank you for coming. All right, that concludes citizen communications. Thank you all for coming. Your feedback is important to us, and we will be considered by the board and discussed prior to the adoption of the budget and tax rate by the Central Health Board of Managers. With that, agenda item 2, announce the date, time, and place of the meeting in which Central Health will vote to adopt the fiscal year 2019 budget and the associated tax rate, and confirm the date, time, and place of the second public hearing on the proposed fiscal 2019 tax rate. The meeting in which Central Health Board of Managers will vote to adopt the fiscal year 2019 budget and its associated tax rate is on Wednesday, September 12th, 2018 at 5:30 p.m. The second public hearing to be held in accordance with Chapter 26 of the Texas Tax Code will be on Wednesday, September the 5th, 2018 at 5:30 p.m. These meetings will be held at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas 78702. And I'm ready to accept the motion to close the first public hearing.
I move.
Okay, all right. So I have a motion by Board Member Meester.
Close the first public hearing on the proposed fiscal year 2019 budget and its associated tax rate.
Okay, I have a motion by Board Member Musaif and seconded by Board Member Valdez. All in favor, say aye.
Aye.
All against, say no. Anybody abstaining? The motion carries. We'll take a 10-minute break before convening the Central Health Board of Managers meeting. Thank you. All right, it is 6:46. I will now call to order the meeting of the Central Health Board of Managers. The first order of business is citizens communications. Our first speaker will be Suzanne Woodley, Del Valley Independent School District. Woody? Suzanne Woody, Del Valley Independent School District.
Hi, thank you. So I'm here to answer any questions regarding my interpretation of the collaboration with Central Health and the Del Valley ISD District, if anyone has any questions. Also, I think it's been about a year since I've been here asking for funding for our community. And I, as a stakeholder, I would like to say that I'm actually very disappointed in the amount of progress that has been done for our community, in the lack of services and just the overall timelines. I'm getting a lot of, we may, we can, we're working on it. We might fund you. We might get you a facility. We might have this. We can do this temporarily, but that's not acceptable. We have people dying out in our community. We have a huge population who has never even seen a doctor. They're not part of your surveys. They're not part of your nice little charts because they've never seen a provider. My philosophy in this whole thing is, if you build it, they will come. If they have nowhere to go, they're not gonna go anywhere. They're gonna stay, they're gonna be sick, they're gonna die in their homes. That's not acceptable. Again, that's my community activist part that is coming out, but as a Del Valley ISD trustee, I'm here to collaborate as much as possible because I know that there are very wonderful people in this organization, in this and I know that if we really work together and it's really something that you want to do, it can get done. I'm not asking for wants, I'm asking for needs. We need this stuff in our community. We don't need it tomorrow, we need it 20 years ago. I'm not begging anymore because we pay for these services. Everyone out there pays Travis County. Everyone out there pays Central Health. We pay for these providers. I mean, we have a bunch of wonderful providers coming out here thanking you for all the funding that you've been giving them. When are they going to come to our community? They can't. There's nowhere for them to go. The Del Valley operation, 2 days a week, 40% increase in patients. How long has it been open? Less than a year. 40% of people who have never seen a provider in less than a year. Again, if you built it, they will come, but you have to build it. Mobile facilities, not acceptable, in my opinion. Like, I know it's a short term, but not acceptable. Thank you for your time.
Thank you, Ms. Whitty.
Thank you.
Mr. Richard Franklin, Del Valley.
That was a good cop. I am not. I've been here before. This is another lesson of futility because it seems like every month we come here and have the same conversation with you about the fact that why do you exist? Why do you exist? I have to make an appointment in my community based on your budget to get sick either Monday, Wednesday, or Friday during the hours you're going to allow me to be sick. That's ridiculous. You know that over 1,000 people have already gone to the facilities that Central Health provides. Over 1,000. Why do I have to justify you giving me what I've already paid for? The community that was in here earlier talked about all the services you provide and they're so happy with you. I sure wish I could say that. I sure wish at some point in time I would walk up here and say, you know, that's a beautiful facility. 10 years late, but thank you for having finally gotten around to it. But you're talking about giving me a temporary facility, no pharmacy, open 3 days a week for people who are going to the doctor when they can get on people are dying. This month, I got 3 emails on Facebook, emails, people asking, what do we do? How do we get there? Where are the facilities? People are dying. They're in their homes. Mike Easton came to a meeting last month. This month. And the people told you, it's like, yeah, we don't have a way of getting there. There's nothing for us. We finally heard the stories of people who are taking care of other people in the homes who can't get out. That's what's happening. And you're talking about giving us a temporary bus. It's going to be somewhere. That bus thing you're talking about right now, unacceptable. It won't work. You've already been told it won't work. But that's on your agenda. That's actually on your funding list, is a bus that won't work. Tell them, Larry, it won't work. It shouldn't even be considered. Toilets, waiting rooms, the people in my neighborhood, sick people among kids. How ridiculous. When do you give us what we're supposed to have? This is ridiculous. And I'm tired of coming here every month looking at you, looking you in your eyes and going, when are you going to ask the hard questions of the people who are running this show? Millions of dollars every year. And we have to come in here and beg you, please get around to us. We're the underserved, out of sight, out of mind community. And that's the way it's being addressed, because those people over there talked about how wonderful you are and all the things you're doing for them. And they ain't in my neighborhood. They're not in my neighborhood. None of them. But you're funding them. And they're real happy about it. At some point in time, make me happy. See if that ever happens.
Thank you, Mr. Franklin. Our next speaker is Andrew
Costigan.
Okay, sorry, Andrew. Democratic Socialist of Austin, America. Okay.
Yes, TSA. I'm also a graduate student at the University of Texas, studying educational psychology. I'm an educator, and I've been living in Del Valley, Cedar Creek, technically is my postal code, for 6 years. And I come here today also a supporter of Susanna. I was helping her on her campaign, and got to know via that campaign more about my community, where I, again, had been living for quite some time. And I think I may have a slightly different perspective than the general community member in my area, because I had moved there from living in Austin beforehand. Prior to that, I was living up east, and in short, I had not. I moved out there essentially because the rent is cheaper. I have more space, and there's a lot of really awesome people out there. But I had never really seen or experienced the kind of health issues that I saw through meeting people, making friends, and getting to know the community. And I think that those span the gamut from just kind of core physical health care issues to mental health. One of the really significant issues in our neighborhood, and I live on Tucker Hill Road, which is essentially at the edge of Travis County. My backyard is Bastrop County, is actually drug addiction, which I see as a mental health issue personally, someone who's been studying psychology. And I think that I just don't see how we're dealing with this issue right now in any kind of constructive way. So I would actually echo some of the sentiments of the two speakers before me in terms of sort of also perceiving a kind of lack of facilities and resources for people out there to deal with. According to the testimony that I've heard from some community members out there, the only time they've interacted with some sort of mental health care service for drug addiction is through being in the jail in Del Valley, which is also, according to some testimonies, not a particularly effective treatment. That's the anecdotal responses I've gotten. And my time is probably running out, but also to echo something that Richard said, and I'm keeping my cool, but last year I had 3 people that I knew closely from making friends and being part of the community out there die. And I would say that in each instance, all of these events were most definitely avoidable and rooted probably in both physical and mental health issues that could have been addressed earlier. So thank you very much for your time.
Thank you, Mr. Singh. And then next speaker is Mr. Mike Giesland, Central Health. Oh, sorry. Sorry. I'll speak up.
Members, I wanted to take a moment, especially in light of citizens' communications and the importance of the messaging that's received here. This may seem somewhat out of order, but I don't want to dilute anything that's been said. But we did need to take a moment to, I wanted to recognize Mr. Heath. I've been told since 2005, you've been with us and working with us, and I think this is your last meeting, if I'm not mistaken. But I think it's important to take a moment in citizens' communication to recognize that service, and walking around and just asking individuals. Some fond memories there, and you're so quiet that it's hard to say, speak loudly for somebody that is so quiet, but I think that that's a testament to your work ethic. So thank you very much for what you've done.
Thank you all for coming tonight. Tonight's agenda will be taken in numerical order. Agenda item 7 will not be discussed. It is the 7 discuss and take appropriate action on Central Health's owned property, including the downtown campus and adjacent properties. Agenda item 1 is receive and discuss an update on A, healthcare service delivery expansion lines, and B, the results of the community survey about Rosewood Zaragoza Health Center and recommendations on future service programming to be provided at that center. This item is scheduled for 20 minutes. Sister Larry Wallace will be presenting, and no action is expected to be taken. Ms. Wallace.
Thank you. Good evening. I am going to provide our latest projections and timelines on the projects, and I am going to give you a quick summary of what you will see in the slides. And by quarter, first quarter of 2019, that is October, November, December calendar. As you've already saw from Jeff's presentation, the business plans, all of the contracting requirements, ground leases are expected to be completed during the first quarter. In addition, the work with Rosewood Zaragoza, we expect to be bringing in the first quarter the final recommendations on that project, and you're going to hear more from Ted on the survey results. In the second quarter, it is our expectation that we will have in place 2 modulars, one located at Austin Colony Hornsby Bend at the Emergency Service District number 4. And the second we expect to be located at Colony Park, most likely near the Recreation Center. In addition, in second quarter, and Michael addressed this, I'm expecting that we'll have approvals coming your way that addresses Elroy and that surrounding area and the UT School of Nursing project. In addition, in the second quarter, Community Care will launch their school-based clinic at Pflugerville, which will be located at Pflugerville High School. We expect in the second quarter delivery of a mobile unit, which is projected to serve Creedmoor and other communities as deemed appropriate. In the fourth quarter, we will likely be talking to you about beginning 5 construction projects that involve permanent facilities. Those projects would be in Austin Colony Hornsby Bend, Community First, that's the Mobile Loaves and Fish project, Colony Park, and Pflugerville. And again, Michael talked about the Elroy UT School of Nursing opportunity. We also will expect the Travis County Del Valley project in fiscal year 19 to be funded for programming, and that will probably roll over into fiscal year 20 for actual construction. There are two other projects that we can't project because we don't really control them, and that's an opportunity with the city to participate in additional services in Rumberg and Dove Springs. But community care stands ready to participate in those projects. So that's just a summary of the work, and we'll look in detail on these charts. And so the first chart, okay. All right, so we are starting with the Northeast Travis County work. So the first project is Community First Mobile Loaves and Fish. No, this is the project that serves the homeless population. We have completed the programming efforts with the partners, and in the first quarter, the business plans and legal agreements will be executed. Alan Graham is, he'll handle the fundraising for this project. It will be totally funded for this project out of his efforts. So the health center, the land, all of that is really going to be his responsibility. And I'm sure we'll hear about this when that fundraising effort is launched. We are projecting groundbreaking construction in the fourth quarter of fiscal year 19. Colony Park, there are two efforts. The long-term solution, which is part of the master development plan that is led by the city. We, again, don't control those timelines. We have latest information that calls us to revisit and rethink, can we do something in the interim? If the city is going to be 2 to 3 years, we don't want to wait that long. So we think we need to do something sooner. And so as a result, we are moving forward to procure a large modular. Right now we have the small modular that's located at Overton. It's really not, enough space in there really for all the partners to do what they want to do. So we met with the Independent School District yesterday, and we got a favorable nod to be able to locate a large modular, which would be located right by Turner Roberts, near the resource center that's already in place. If we believe that process could move quickly. Again, the business plans, the ground lease, that work will be completed in the first quarter. And the modulars, Stephen's already working to get those ordered. He has a couple of vendors lined up that use Travis County, so he doesn't have to start over with a solicitation process. And so we think that will really expedite this process. Pflugerville Independent School District, I've already mentioned. Community Care will launch a school-based clinic in March of next year. Business plans will be developed. They are already in the process of being developed. And long-term for Pflugerville, we believe that in our third quarter, we'll be coming to you to talk about acquisition of land to build a new Level 1 health center in Pflugerville. In the meantime, those conversations will continue and the business plans will be developed. Southeast, we'll walk through each of those projects. I've already mentioned with Austin, Colony, Hornsby, Bend, those agreements are already being developed with Holly and her team from the county. And we believe those lease agreements will be coming to you soon, and Mike can speak to that in a little bit. But that work will be done in first quarter. And in second quarter, we anticipate that we will have a modular in place. That's the first step in addressing Austin, Colony, Hornsby, Bend. As I had mentioned earlier, we are still in the process of procuring land, and we will continue to with those efforts. And once we have land identified and a contract is we get a contract, we'll be bringing that forward. We don't think it's going to take to the third quarter to identify the land. We really believe that that should happen within the first quarter. Negotiations for contracting, that will take time, but we can give you updates. But we believe that if this process moves according to plan and we're able to acquire the land in Austin Colony, Hornsby Bend, we will be able to develop a long-term solution with the Permanent Health Center and start that process in quarter 4. Elroy and community sites, there are business plans being developed. And Mike, would you like to elaborate, or I can just continue?
Yeah, just continue, and then I'll pick
Okay.
up.
And so the goal is to have that work done in first quarter, and following in the second quarter, the building design and construction we expect will begin, and it'll roll over into the third quarter. Creedmoor, that is, the business plan is being developed by Community Care, and the goal there is to acquire a mobile clinic, and we expect that it would be operational in the second quarter. So we continue to look at the long-term strategies, but anything we can do sooner. We believe that we're trying to get something as quickly as we can. And so that's the reason we continue to advocate for these interim solutions as opposed to waiting until we build something. So that is my report. The last slide, I think it just talks about Runberg, Dove Springs, and Rosewood Zaragoza, which I've already alluded to. I'll answer any questions. And Mike, at what point did you want to have comment?
Probably jump in.
Mr. Gill.
Thank you, Mr. Chair. Thank you, members. So I'll add some commentary to the timelines that Mr. Wallace had laid out. First, the reason for some of these timelines, and you'll notice that we've had to adjust these, but if you could go back to there you go. So we've had to adjust these because we realized as we were pressing forward, looking for site locations, we needed to catch up on the process of the business planning with the provider partners. Because as you know, we are 100% dependent upon our clinical partners, be it Community Care or the other FQHCs or Integral Care, as well as our county and city partners that provide social services, to have the business plans in place ready to go. Because the last thing you want to do is have a real estate investment, have a building, and not have people inside to operate and provide the services. So I think that we're in a much better spot where we were in terms of our business discipline of making sure that we're not outpacing our own planning efforts. Nonetheless, we are intensely focused on, there's 4 areas that I would point out as, they're all priorities, but they're ones where we feel like we need to make significant headway on. And that's going to be Colony Park, and then the areas in Del Valley of Hornsby Bend. I'm talking greater think about the school district boundaries, but looking at it from a community standpoint, Hornsby Bend, and then the Elmore Road and surrounding community sites. These are, and Creedmoor, excuse me. So there are some ground leases that Larry had pointed out that I'll quickly touch on. We have what I would say substantially completed the drafting of these ground leases and transmitted them to the respective ESDs. To their credit, they've probably had them not even a full week, so I think there's some time that they need for their legal counsels to review these ground leases. We have attached an interesting concept to these ground leases because, again, we don't want to get ahead of our own business planning, but it's making sure that there's a state of readiness that's announced before the ground leases take effect. So that makes sure that we can deliver on the service dates and the openings that we say we are. As Mr. Wallace mentioned, we will be bringing these ground leases back. We are pushing to have these to the board at the September 12th hearing. But, you know, if there are some substantial issues that still need to be resolved and it takes a while, the back and forth with negotiations, and I would certainly say by October. I will say that both ESDs have been extremely cooperative and I feel like are expediting these issues as fast as they can as well. So I don't think there's any cooperation issues that, of note. Something else I'll say is about the service levels that are being provided. When you look at some of the numbers, for example, in Colony Park, we have served by Simple Health programs, a little over 2,400 people. If you aggregate some of the areas in Hornsby Bend and some of the southeastern Travis County areas, that number is around 2,800 patients. And so there are literally thousands of patients that are receiving care. The challenge is, members, and the reason why we're bringing capital plans to you as part of this budget process is because the care's not in a convenient place. And so, for example, if you take 78725 zip code in Hornsby Bend, there's roughly about 1,000 patients, most of them seen by community care. Some of them are going to Southeast Health and Wellness to receive care. Some of them are going to South First, and some are driving somehow or getting transportation some way to North Central. And so we're providing services to people, but again, it's not in a convenient way, both in place as well as time and availability. The short-term solutions are not ideal. They are not perfect, and yes, they will be subject to public criticism. And I completely understand, because if you've been living out there for a number of years and you've been paying taxes and you want to see something, you want to see something that maybe looks like Southeast Health and Wellness. But again, I think getting something out there on a short-term basis while we do smart land acquisition, we don't want to buy anything in a floodplain that's going to be underwater, and then making sure that we're working closely with our provider partners, be it community care or somebody else, to make sure that we have the staffing models in place and we right-size this clinic, then we're able to increase what we're doing already for the thousands of patients with more convenience while we bring the longer-term solutions online. So I wanted to discuss, just the overall approach a little bit and get your feedback and questions. I think with that, I'll pause. There's a second agenda item that's listed regarding Rosewood Zaragoza, but I'll pause there.
Ready for questions? Are we going to go to the second agenda item, or?
It's up to the chair and the board.
You want questions now? Ron?
Thank you, Chair. Thank you, Larry. Appreciate all these efforts and expansion. One thing that I'm looking at, what are our plans for Del Valley? I don't see anything here on this plan. Just wanted.
You mean the Travis County Del Valley project? When you say Del Valley, specific?
Yes.
Okay, yeah, Travis County, and what I had said earlier.
I'm just trying.
No, it's not listed, okay, but it is slated for fiscal year 19 for planning dollars to be executed by the court.
I'm sorry, I can't hear you.
Travis County, I think you may have been there a couple of weeks ago when Sherry Fleming and Stephanie Hagan and I presented to the court, and that project was talked about. The goal is for them to have planning dollars allocated in fiscal year 19 by the court, with construction to start in the latter part of fiscal year 19 and rolling over into 20. So that's probably almost 2 years away before that site will be completed. And that's a Travis County project.
And it's not a Central Health project?
That is a Travis County project with community care participating.
So I'm just trying to clarify, I know you touched base on this a while back. And so what are the barriers for us to have a clinic there? I'm just trying to understand, and I know I've heard many of our community come to us and present, and I know our intentions are there, good, but I just wanted to know that project's going to be 2 years in time frame, I don't know, or more, but in the next, like for today or tomorrow, what is the plans that we have?
May I address that?
Mr. Gieselman?
There's really not a barrier in terms of like a legal barrier. It's one where part of this is at the request of the county, or the encouragement of some county commissioners as well, but to try to co-locate with the county where we can. And because that's a county property and a county building, they just haven't built it yet. I do know that it's slated for consideration as part of this budget cycle, I believe, for the planning dollars and then the construction. If you look at a map, though, and this deserves a deeper conversation, but just quickly for purposes of answering your question, I think that as we're putting up temporary services or flex solutions, if you will, for some of these areas, but then we're also looking at other long-term locations in southeast Travis County, for example, and in Hornsby Bend, for example, that we're going to have to be very careful about how we scale and size various clinic operations. Because you've heard some of our clinic partners talk about you'll be competing against yourself. Now, there are many more patients that still need care, that don't have an established relationship with a provider, as you've heard already. So we know that there's some patient basis that we can grow. The reason I mention that is because it's not a barrier, it's not stopping us. I think but it is a consideration that we're going to bring back to this board to make sure that you all are fully aware of when and how and to what scale these longer-term clinic solutions come online.
So until we have these longer-term solutions, I'm thinking probably shorter term, can we have at least one primary care physician at their location, like at least 5 days a week? Rather, I'm just trying to think of outside of the box in an efficient way to deliver those services for folks who need it. So.
Yes, and
I know it's. Go ahead.
I think you're aware that Travis County allowed us to use their employee health clinic.
Yes.
As often as they will make it available to us. It is not available 5 days a week. And so we take, community care does, along with integral care, use that space whenever it's available. And I believe, Jason, is it 2 or 3 days?
It's 2 days.
It's 2 days now. 8 to 8. We would love to have more time, but again, we don't own it. I think community care is taking into consideration, can they do some maybe weekend hours when it's not being used? So it's not going on deaf ears that there's more that's needed. And we're trying to work within the limits of resources that we have. And in this case, it's someone else's space. But long term, it'll be a better facility when phase 2, the larger facility is built and community care can be there full time. That's the ultimate goal.
So as right now we're going through this budget season, so is there a way if we probably, I'm just thinking outside right now, depending on all our board members, to allocate additional funding for Del Valley to temporarily open a space until you have a long-term solution for them? I'm just saying a way that we can really think, because we have, right now we're still reading through our budgets, if we can allocate and move some budget around to expedite it in a way.
I think, Mr. Chairman, what I'd like to do when we come back next week is right now we've put this in a timeline form so you can see what our business processes are. But I'd like to be able to pull a map together, which we've got the maps to show you what the future service expansions are. But then I think to get some of the clinical providers to help answer these questions, because it's not just a question of how many patients can you serve. It's also looking at the geographic and how location and how close these different service offerings are. The second thing I'd like to bring back next week is for Hornsby Bend. I realize this isn't at the communities around the Del Valley facility there by the airport that you're referencing, but there is a pilot project that Community Care is exploring about getting home visits out there. So it's a way to provide care to people, both current and potentially new patients that may not be coming to a fixed locations or not be ambulatory. So I think there's another outside-the-box approach that we can also bring to and talk about. But I think clinic siting, PE, is probably a separate conversation that we need to bring some of the clinical experts to the table to fully answer your question. Thank you.
Cynthia?
I think it was over a year ago that Julie made the motion that we prioritize Del Valley. And we were not talking about waiting for Travis County to budget monies for the expansion project next to the
Board member, can you speak into the speaker?
I think it was over a year ago that Julie Oliver made the motion to prioritize a clinic in Del Valley. And we were not talking about the Travis County employee portable being used on a part-time basis. We were talking about a facility for Del Valley's residents to have access to. I think almost everybody supported that, and we voted for it. Between then and now, I think, Larry, not to take away from any of the work that you and your team have done, but I think within a relatively short period of time, the community could have told you what their priorities were, where they would have liked to have been seen it cited, or very quickly have organized to get that information. If you were needing data, if we needed data, they could have very quickly done it through the school system in working with the parents and their monthly or weekly PTA meetings, depending on what campus you went to. They already have years of complaining to us about this situation, and within a short period of time, they could have given you what they would like to have seen in their plan, not waiting for us to get a team together to organize, send out questionnaires, or set up meetings with a lot of other entities to get them to the table. I mean, talk to the community directly and have them tell you what they would like to see with Jason. Sorry you weren't here, but you came on as quickly as you could. Having Jason or his team member in place, hand in hand with the community, telling you, and thank you for having just relatively recently completed your community needs assessment, healthcare assessment, but working together to develop a strategic plan with a short timeline of implementation. And if it meant that perhaps maybe we needed to have done some certificates of obligation. I know we've had a lot of other issues to address and on our plate. That's why I can't take anything away from what has happened, except to say that I know when there is a will with the community and when there is a need, that community will come together and they will do extraordinary things in order to make sure that they communicate what their needs are and where at least one facility should be put. I think that in talking to them, and if we had to have a weekly meeting, then we need to have a weekly meeting so we can move forward. And that's it. This other long-term, short-term and long-term planning, I see the need because that's the way government operates. But when you're in a community of great need that has been putting lots of millions of dollars into our healthcare system and not received equitable treatment or equitable concern, then I think we have a real problem. And the fact is, as I have stated, and they have stated time and time again, when you talk about Colony Park, you're talking about a city of Austin. They have infrastructure. They have a bus system. They have streets. Del Valley does not always have that. And the people who live in that community don't have buses, don't have transportation. Some do not have streets or ways to get there. So I would have thought that last year, as we come into this fiscal year, we would have already had that communication occur. Not waiting for a monthly meeting, but rather, if we have to have a weekly meeting, then we would do it to accomplish that goal that we voted on way back when. And so I can feel the frustration and the anger that those community members feel. And it is very hard not to look in the mirror and not be equally disgusted with myself for not having done more to have made sure that this happened some time ago. So I would like to know, board members, what it is we can do today to expedite this project where there is no infrastructure to be able to accomplish what can be done in Colony Bend or in Pflugerville or in any other location that has a city and a county and other supportive resources that do not exist in 172 miles of what we know is Del Valley. And if you look at what was just told to us, in the Colony Bend area, there's about 2,400 people that we know of that could access resources that would need our help. But we're not talking about what happens in Del Valley as many rural communities, and that is they're undercounted. We don't really know who's living there because half the time they won't even come to the dadgum door and tell you whether they're legal or not. And so when we're talking about people who have great needs and don't have a way to access those resources, we're not talking about a regular situation. We're talking about something that is immediate and it causes death. It may not have been a big problem 2 years ago or 5 years ago, but it's an extraordinary problem right now. And I think that we need to do something to make sure that this community hears that we are going to do more than have another planning meeting to look at what it is we can do. And so I'm asking that we actually talk about that and make a decision to just move as fast as we can to make sure that if the Del Valley Independent School District has to call a special community meeting next week because you got 72 hours to put out notice, then they can have it done. And our board members should be there to hear what they're going to say. And Larry and Mike, our support people and community care support people, if we can be there to hear what they need, now they know what they need. It's us who are providing the resources to them. They've already given us the tax dollars, so we're not talking about something more that they can give us. We want to be able to give them what they should have had a long time ago. I apologize for speaking, but I do think that this is beyond anything that we can excuse anymore, and we need to take action today.
Thank you, Board Member. Yes, ma'am. Member Valadez, you don't need to apologize for. Shouldn't apologize for speaking, but I would say we are.
I know so many of those people there.
We are beyond the general collaboration, and we're in execution mode right now. And so to answer your question, what can the board decide? We're not posted. We're posted for an update right now, but next week, if you want to tell us to stop doing what we're doing and focus on one area, we can do that. But I will say what has been happening over the past couple of months in a very, and the executive team has been told there is one thing that we need to deliver on, is Strategy 1.1. And I don't know if you're aware of what that is, but you approved that in July, and that is get services out to people. Mm-hmm. But the reality is that in being in execution mode in those projects that you've seen, we have not just made soft commitments, but we are lining up legal documents. We have started the procurement process. We're getting commitments from provider partners. And again, there's 4 areas where we're focused. But if what I'm hearing is, no, you want to go back to that Del Valley facility that's there by the airport, then we really need to stop what we're doing, and we'll have to go back to Hornsby Bend and we talked to some school board members today about Creedmoor. We'll have to go back and undo all of that. And I would really urge this board, and I understand the need maybe to focus on one area, but the reality is because of distributions and patient populations, there's really 4 that we need to focus on in terms of the short-term solutions. Having said that, it is a prerogative of the board next week, if we post this as an agenda item, to make a motion to direct management to take a different course of action. But you'll be undoing several months' worth of work, and I'm afraid that you'll set us back. But I understand if you want us to go back and focus on that longer-term Del Valle facility. I'm not so sure we can lean on the elevator button on that and make anything happen, because it is the county facility. But, you know, correct me if I'm not understanding what your and Maram's conversation is about.
I wasn't necessarily speaking to what Travis County will do or has planned, because we can't control them. What I was looking at was what we can do as Central Health and Community Care working together.
And I think in terms of the longer-term solutions, the second part to my answer, and I'll be brief, members, but, you know, it's a matter of public record that because of Sendero's financial situation, we needed to allocate $36 million. Originally, we had budgeted for. And anytime you dig into your cash like that and your assets, it sets you back a little bit in terms of longer term. Now, I feel like that, you know, we're doing what we can, everything just shy of purchasing in terms of locating land and approaching landowners and getting ground leases ready to go. But, you know, that's just an economic reality. And you have people, you know, Sendero's provided a lot of health care for a lot of people. And I think that, you know, the board needs to remember the financial exigencies that it was faced with at the start of this year. So
I understand, sir. And I think that if we had begun to have those,
a little closer.
If we had begun to have those very serious conversations with the community right then and there, and I apologize, I'm not going to take this again, but I believe that we could, we had honest conversation with them. We tell them right then and there, well, this is a situation we're in. These are our options, or what would you like for us to do? So that at least they could have given us direction as to what we should have done, at least in that area. And again, the issue is the fact that they're in an area where there is no infrastructure. Other than the school district, it's not a city of Austin. It's not Pflugerville. It's not anything that has whatever services. It's outside the Capital Metro boundary lines. There's no bus system.
Yes, ma'am.
So if we could talk to them right then and there, not say we'll come back with you with answers and get them to do it. I ask that we expedite this for that. If we can't make a decision today, it's not an agenda item. We're receiving this information, which we greatly need. But if we could do something as quickly as possible, that's what I'm asking for.
Thank you, Cindy.
Point of order. Can we proceed around the table so that we can all have our input into this discussion?
Yes, sir.
Here.
Yes, sir. Terry?
I would like for my fellow Board of Managers member to be able to go before me.
Ken?
Well, I wasn't asking to go ahead. I just
I think it would make sense
dialogue
around this way.
I guess I am agreeing with Member Valadez about Del Valle. I haven't been on the board anywhere near as long as you have, so I think that some culpability goes before this current board. So what happened to get us here? Because Del Valle is not a new issue. I mean, from a public health perspective, we've been looking at this data for years and we've been sharing it, so it's nothing new. So to say all of a sudden we should solve this problem right away, I just think is disingenuous, because I don't know what we did in the past to try and address these issues. Having said that, though, I do believe that when we say Del Valle, we need to be clear what we're talking about. Because Del Valle, as you've indicated, geographically is very large, but the independent school district has multiple areas. Del Valle School District covers both Hornsby Bend, as well as the Del Valle
Elroy, Creedmoor, etc.
area. So when we're talking about urgency, what is it that we're talking about? This facility or those facilities? So we need to be clear on that. I agree with Mike in the sense that we have started down a road in which we're talking about a strategy for the entire area. And I think we should continue that. However, I do think we need to put some elevation, particularly on this clinic as identified for the Del Valle community, identified by, what is it, the southeast, the area where Travis County location is. Because that's the clinic I think you're talking about that was serviced.
That's the jail clinic. It's a temporary fix. It wasn't.
No, but you're talking about a permanent one for that area.
That's Travis County's. Yes.
So if we're going to talk about that area, I agree, we need to focus on that area. But let's not say Del Valley and says that's Del Valley, because Hornsby Bend is also Del Valley. So I want to make sure we're clear on what we're talking about in terms of where we want to put our priorities on. I'm advocating we need to put them on all of the areas. But given what you've said and given the history of Del Valley, I do agree with you. We need to somehow or another move that one along a lot quicker as well. But all of these areas need to be incorporated in this discussion.
Thank you, Jen. Sherry?
Thank you. You addressed one of the questions I was going to ask, and Mr. Giesland earlier mentioned next week having a map, and I think that would be really helpful because we need to have a common definition of what we're calling Del Valley, and that's what I was going to bring up, because are you talking about Greater Del Valley? And you just mentioned that. So if we could come up with, next week, looking at the map and come up with a common understanding of Del Valley and the different portions of Del Valley, that would be helpful. So I would certainly like to see that. Beyond that, I concur. I don't want to see us certainly stop with these projects that are desperately needed in these areas. But Larry, when you made your comments earlier in the evening, I can't remember if I heard you say something about not being happy with the speed at which the Travis County facility was moving, or that we need to be careful because we have the one that's open 3 days a week, but
2 days. 2 days.
Excuse me, 2 days. Yes, 2 days a week. But my understanding is that there's been this long-standing issue because of the road work and Travis County shutting down that facility, right?
That's true.
So are there alternatives to us waiting for Travis County to move on that capital improvement project?
I don't think that I'm prepared to answer that
Okay.
question.
I didn't expect you to be, but it's a question that I'm posing so that next week. Okay, thank you, Mr. Giesland.
So we mentioned, we didn't talk about it, but there's the Elroy Road and surrounding communities. The reason why we put surrounding communities is because the conversation has shifted from locating something at the Elroy Emergency Service District station to...
And let's stop. ESD earlier, that stands for Emergency Service District.
Thank you. And looking at a property that the ESD, if you allow me to use shorthand,
Yeah, that we defined it.
has a little bit closer to the high school area, and probably it's in a better location, but that's a project that's going to be worked in conjunction with the UT School of Nursing as well as the ESD that has advanced level providers. And then we've also looped in community care into the conversation as well on this. The reason I'm bringing this up is because when you look at it on a map, and
Which we're gonna do
you'll see
next
this in more
week.
detail, it's on the wall back there, but you'll see this in more detail next week as to where that longer-term Travis County facility would be, and then where another facility would be literally less than a few miles from that Travis County facility. We may very well be up and running faster, maybe, and I don't know about, a lot of it depends on it, because you're talking about site-built construction, so
Right, right.
there can be delays with that. We're going to have to allow our clinical partners the ability to make some decisions about long-term, do you need to be locating all these different facilities that close to each other? And so I'll sum it up by saying we're going to continue to work with the county on this because it is a much-needed option, but it could come down to, in a couple of years, if you built both of them tomorrow, needing to scale one back or close operations in another because you're more or less competing against yourself with the same patient population. You've added costs, which ultimately, do we ask our clinical partners to foot that bill, or is that something that we pay for?
So I understand. It's like when you look at building, the city looks at building the fire EMS stations, right? And they do the circles and the response time and all that. We're talking about something similar, but what I would like to see is next week the map with everything mapped on it, with what we're doing where, with talking about what is Del Valley, with our with the ability of the service partners, and I understand what you're saying. I also know that this area is going to, or believe looking at past demographic trends and what's going on now with involuntary displacement in areas that are gentrifying, the need's going to continue to grow out there. It's unfortunate people move because the rent is lower, but then they get out there and they don't have transportation, they don't have grocery stores, they don't have all these services as we know. So we're not going to make decisions tonight, but if we could get the information for next week, I would like to see what we can do to accelerate anything we can in that portion of Del Valle, because I realize it's a larger area and we'll see it mapped.
So members, the decision then, because we'll need to put something on the agenda that indicates action items. It's going to boil down to money.
Yeah, I know. There's one pie. I get it.
By that point in time, with less than 3 weeks left in the fiscal year. And again, when you look, and I'm not saying that we shouldn't post it for action, and we'll put together in a short period of time what we can, but what we'd be asking you to do personally might be a financial shift, but when you, again, look at the $32 million that we needed to reallocate to Sendero.
I understand.
You don't have a whole lot of options with the short period of time that's left in the fiscal year.
I understand.
I know I'm missing a whole lot of factors, Member Greenberg, in terms of, what all the necessary exigencies that go into that decision, but that's the biggest one.
I understand. I think we'd just like to see more information, at least I would, and I've heard from some fellow members next week.
And in the interest of time, we can also provide information on the amount of outreach that did occur early on in this process of connecting with those community groups to say, look, yeah, we've seen some data, but what is your sense about what we need to be doing? And it was an interesting and sometimes conflicting set of input that you had some push-pull among various regions out there about who should get what first. But we'll do our best to, we talked about it before, we'll bring it back again.
I think that along with the maps and everything that we talked about would be extremely helpful.
Will do. Julie.
So I know I've asked, I think a couple times, if we can expand service days. Have we asked Travis County if we can expand service days?
Yes.
And what was their answer?
No.
Did they say they would revisit it?
It's a capacity. They use it for their own purposes.
Mm-hmm. Oh, I thought they only used it 2 days a week. That was my impression the first time. They used it 2 days a week. We were going to use it 2 days a week.
And the other days is not made available to us. We have made that inquiry.
Even weekends?
And I just mentioned that community care was going to go back and explore Saturday hours as a potential to see if it's possible.
But we wouldn't take the charge on that?
Pardon me?
We wouldn't lead the charge on discussing weekend hours with the Travis County and community care?
We took the lead on all of this, Central Health, to bring community care and Travis County together to get what we have. And
I understand that. I'm asking about weekend hours.
Yes.
I don't know if I have an answer.
Short answer is yes.
Yes,
Yes, what?
We can move that question back to the county on, can we be there on the weekends?
Well, I mean, I just think we need, again, like you've mentioned, we need to prioritize some help out there and immediate help. And if we can get weekend out, why wouldn't we? I mean, it seems like it's a low investment for us and a lot of benefit to them. And I guess I don't understand the pushback I'm receiving on this.
There's no pushback. There's no pushback. Let me be clear. There is no pushback. What we're trying to do is respond to this board and what you're asking us to do. There are almost a dozen projects that we're working toward. And to me, all of these communities are important. Now, we can set priorities, but you go into a community and say, this one's more important, I'm really concerned what that speaks. And as an organization, as staff, I don't want to go there.
I don't think that's
to me, it's all important. And we have a certain amount of resource. Community care has been great. I mean, they have stepped up to the plate, and we continue to push. And I think we have a willing partner. we also look at other partners that will help us, because I recognize community care can't do it all. But this work is really important to staff. We take it seriously. We don't enjoy coming to these meetings and hear people make comments as if we're not doing anything. But we accept it. It comes with the territory. And we will continue. There's no quit here. We will continue. And we want to work with you as a board. And we will follow your directions. And we'll do our best.
Thank you. Any other board members have anything else to say before we move on to the next subject?
Just one thing. Mike had said earlier, this question with regards to capacity in services to other locations. And I think that one of the challenges we face here is we want to do a lot in a whole area rather quickly. That's not going to happen, so we're going to have to prioritize. And I think that the message has gotten out there. But I do think we need to be cautious that we don't get in the situation of having our providers drive what we as a board said we need to be doing. There are no facilities east of 130 in this county. And so the question is, as we look at developing strategies out that area, we need to keep in mind that, yes, we can have innovative, creative ways to do things, but a fixed facility plays a lot in terms of people's community and their approach to health. Yeah. And so let's make a commitment that yes, we can be creative in all the ways we want to in bringing health to folks. But one of the things we need to do is to make sure people feel comfortable that this board is represented by having services in that area and not just brought to that area.
Yes, sir.
I understand completely what you're saying, because we've seen that with the Southeast Health and Wellness Center. Exactly what you're talking about, what it means to the health of the community to have that kind of resource. I wasn't on this board when that project was envisioned. I know Cynthia worked on it from the community, but I think that's a living embodiment of what you're talking about. I do want to say that I'm extremely appreciative of everything that staff has done, is doing, and will do to move forward with many moving parts, with three-dimensional chess, and trying to get all these services in this area. And we do appreciate that. And I know I've asked for more information for next week, and you already have a lot of work, so I appreciate the willingness to bring forward this information next week. Thank you.
Thank you. Anyone else on the board? Seeing no other discussion, you heard direction from our CEO and president. If you feel like we're going to need to have an action item for next week, you need to let us know so we can have that posted by Friday, correct, Council?
Tomorrow, because of the holiday.
Okay.
Yeah, Monday.
All right, so if you feel like you need to make a motion, you need to let our executive management team hear that.
Mr. Chair, if I may, we can post this for possible action. So don't worry about the agenda posting. What we really need from you is, if there is a motion other than a funding decision, and that you feel like you might want to make, first I would ask you to touch base with council, because it could be that you don't need a motion. But really what I'm asking you to think about is, of the 4 areas that we've outlined that we really want to focus on, if you want us to back off on any one of those and focus on one, that's really a political decision. It's not really, and I think that can only come from you all. And so you would need to think about what that motion would look like, and let us help you draft that so that it accomplishes the outcome perhaps that you might be looking for.
All right.
And that's just one example. It could be other types of motions.
Next week.
Yes, ma'am.
All right, so let's move on to agenda item B, the results of the community survey about Rosewood Zaragoza Health Center and the recommendations on future service programming to be provided at this center.
Good evening, I'm Ted Burton, Vice President of Communications. In your packet, Rosewood Zaragoza, and I just want to provide you with a high-level overview of our team's efforts. On Monday, June 18th, what seems like a very long time ago, Central Health and Austin Public Health hosted a community conversation open house at Rosewood Zaragoza to gather community feedback and about the type of services that the residents and community members in that area wanted to see at a renovated Rosewood Zaragoza Center. The open house was from 6:30 to 8. 50 people attended. That doesn't include our staff and vendors. The Eastern Travis County Health and Wellness Collaboration recommended which agencies should present or should be there and have a table at the event, agencies that might offer services. And so they set up tables where they could do meet and greets with residents, and some of you I know were there. At the open house, there was a questionnaire, so as attendees arrived, they were given a simple one-page questionnaire available in English and Spanish, and they were asked to visit each table and learn more about the possible services that could be provided. They then completed those surveys and turned them in at the end of the meeting, and then that questionnaire was also available online from the 18th through the 29th. We used a variety of methods to get the word out, to get people to attend this open house. And I want to thank our community engagement and outreach team. I know Yvonne Davila is in the room with us, our communications and community engagement manager, but it was a huge team effort to not only plan and implement the open house, but also get the word out. And again, you can read this in that report, but we used media relations, social media, grassroots outreach to promote the event. The Austin American-Statesman posted it, did a robust story with a link to the questionnaire. We had paid advertising in El Mundo, printed materials that we shared both in English and Spanish at a variety of outreach events, resource fairs, career fairs, health and wellness fairs, and also we provided that to local businesses and organizations and asked them to help us promote the event. We sent out a couple of newsletter notices to our distribution list of about 7,000 people. And then again, used social media extensively to not only promote the open house, but also to promote the questionnaire and encourage people to fill it out. In terms of neighborhood canvassing, our outreach team did in-person canvassing around the center. So not only at the center itself, but at Zaragoza Neighborhood Park, Lions Gardens, Colony Guerrero Senior Activity Center, Austin Community College, the Eastview campus, and Workforce Solutions Capital Area. In terms of the questionnaire itself, we had participants from 49 different zip codes in Travis County respond. 378 respondents picked the English survey and 25 selected the Spanish survey. There's also a list of zip codes so you can see for yourself where those participants, where the questionnaires came from and where the people that filled them out lived. 78702 had the most. The survey itself had two pretty simple questions, and we asked the participants to rank the potential health services based on which ones would be most beneficial for themselves, their family, and the neighborhood. And a total of 403 community members participated in the ranking exercise. And I'll show you the results, but they're also in your packet. I won't necessarily read these to you, but of the English language surveys, 297 total, you can see the ranking results from 1 to 11. And then for the Spanish language questionnaire, you can see the rankings from 1 to 11, and there is a slight change based on the language the person used to fill out the questionnaire. With that, that's a quick overview of the community engagement piece. If you have any questions about that, I'm happy to answer them, or if you want to ask any or have any questions about the actual potential service providers, we can talk about that as well.
Thank you, Ms. Burton. Maram?
Well, thank you. Really, it's more of a comment than a question. I just want to let you know how much I appreciate you and Yvonne for all the efforts that you have done.
The team, they are rock stars. We have a really great team, so
rock stars in my opinion.
Grateful to them for all they do.
Really, this is very informative and helpful, and the way how you're reaching out to our community is much appreciated. And to me, and I'm noticing here the rankings. And the first one on both questionnaires is clinical exams for women and pregnancy. And I'm happy to report, and as you've heard from our community at Planned Parenthood, that we are really supporting and this initiative here in improving women's health in general. So thank you for all your efforts, you and Yvonne and your team.
I wanted to also mention one thing, that this is not a scientific survey or questionnaire. It's just so organizations were able to promote it as much as they wanted, and so just know that
Well, definitely, but in general.
Correct. But I just wanted to add that.
I know
note.
there's a lot of bias, Dean, the way.
Thank you for adding that for me. You knew I would.
Any other comments? If not, let's move on. We're going to lose a couple of board members. Agenda item 2 is discuss and take appropriate action on the Central Health Online Message Board Policy. Ms. Elizabeth Hanshaw Wynn with the Travis County Attorney's Office will be presenting this item. Is estimated to take 10 minutes. Thank you, Ms. Wynn.
Good evening, board chair and managers. I just want to first say that I know in the essence of time, because we still have a long agenda, that I am willing to, you guys can call me directly to answer any specific questions or hypotheticals offline, because I know we still have a lot to go. But I wanted to say, first of all, to give you a little background real quickly. In 2013, the 83rd legislature enacted a law that gives members of governing bodies the authority to communicate electronically outside of their regular meetings. And in doing so, the legislature established parameters in an attempt to ensure that the Texas Open Meetings Act is not violated. If you recall, some of you that have been on the board for a little while, in 2013 there was two big pieces, and one was the message boards. The other one was the video conferencing. So if you remember, we drafted a video conferencing policy, and you guys adopted that in 2015, but that was part of the same legislative packet. So there was a movement for transparency of governing bodies. And so in an attempt to prevent you from committing open meeting violations, we had drafted this online message board policy that established standards for using the online message board. It was sent to you Friday in your board packet, so hopefully you've had a time to look at it before tonight. And you also have it in the packet that's before you today, if you want to follow along a little bit. And the policy basically tracks the statutory language that was enacted in 2013. And as reflected in the Mr. Gieslin's memorandum that was included in your board packet, you're being asked tonight to approve the policy that the legal staff drafted, which includes a section allowing Mr. Gieslin to delegate specific staff members to post information on the online message board in addition to yourselves.
All right.
So if you wanted to follow along, as far as the policy itself, that we did on page 2, we did provide some definitions for you. And I'm not going to go through this very exhaustively. It's going to go through pretty quickly. Those are pretty self-explanatory definitions, but there is one that I wanted to point out to you, and it's number 3, and that's communications. And I just wanted to note that pretty much anything you post on the message board is considered a communication, even if it's a graphic, even if it's a thumbs up or whatever. That's considered a communication. So it would be anything you post would be subject to this particular policy if you adopt it, of course. So as far as the procedures are concerned, which is the next section, according to the memo that I saw, you guys have already been provided your login and password, so we've already started with one. Excuse me for doing that. Any post that you make must be public information or public policy related to Central Health. In other words, if it was something that was discussed at closed session, you can pretty much assume that it shouldn't be discussed on the public forum. Posts will also be subject to the code of conduct and ethics contained in Central Health's compliance policies. So we ask that you please display decorum and treat others with respect and courtesy. Also, per state law, which we put in the policy, when a staff member posts on the message board, you will see their name and title. That's just so that you're clear that this is not some stranger making comments on the message board. The online communications will be viewable and searchable by the public. We also include that in the policy. The communications that are displayed, they have to be displayed in real time, and they have to be displayed in real time in no less than 30 days. Anything past the 30 days, Mr. Gieslin has discretion of how much longer it will stay up on the online board past the 30 days. However, if a communication is removed and it's pulled from the message board, it must be maintained for a period of 6 years and must be disclosed upon request in accordance with the Texas Public Information Act. So let's skip to section 7, which is the rights of the Central Health. I wanted to talk about that before we talked about prohibitions. Just want to emphasize that Central Health will have full control and management of the online message board, which includes removing content that is in violation of the policy and even terminating a user's access. So that's in the policy that you're being asked to adopt, so I wanted to make sure we pointed that out. And switching back to prohibitions, again, because you did get it ahead of time and I don't need to sit here and read to you, I just wanted to emphasize just a few of the things that are listed in section 6 on the prohibitions. The first one being, please do not share your user ID or login information with anyone else. You should not use the message board to inform the public of your personal position relating to a pending action before the board. And just to be clear why that language was put in the policy, the statute uses this specific language. It says the governing body may not vote or take any action that is required to be taken at a meeting. So that was why we put that language in the actual policy.
And that would,
please,
just to clarify, that would include proposing any motions.
Yes. Thank you. Also, and this goes without saying, but I wanted to emphasize it, you should not post anything that is illegal, confidential, proprietary, and including information discussed in closed session, as I just previously mentioned. You should not post anything that is threatening, abusive, degrading, harassing, intimidating, defamatory, libelous, deceptive, or fraudulent. And of course, that doesn't need to be said. I'm sure you guys wouldn't do that. And the last thing that I wanted to point out is in the prohibition list we have, you should not post anything that victimizes an individual or group of individuals on the basis of religion, gender, sexual orientation, race, ethnicity, age, or disability. So that's really all I wanted to cover. I was asking if we should really postpone this to October because you guys have a lot of information to get through the rest of the night. But because the message board has been out there for a while now, I think that there's a little urgency in at least getting this adopted so that you guys can message away. And I just wanted to reemphasize that legal is available to answer any questions in the essence of time. Give us a call, and I'll be more than happy to help you with any hypotheticals or any questions you might have.
Thank you, Ms. Wynn. I need a motion first.
I move that the board adopt the Central Health Online Message Board Policy.
Second.
Okay. We have a motion by Dr. Bell, seconded by Board Member Greenberg. Now we can have discussion.
Well, thank you. This is helpful. I have a comment about the 30 days. Can we extend it to 60 days? I'm just wondering.
The minimum, thank you, good question. The statute, the minimum time is 30 days. But Mr. Giesen can leave it up there as long as he wants, basically. It's just the minimum is 30 days per the statute.
Sometimes we tend to go back, depending on how much we'll be posting, going back to a previous meeting if there was any notes. But I feel 30 days is quite a short term. That's just, thank you.
Understood.
Cynthia?
With respect to what Maram said, so in our board meetings, and those are archived, so it would be something that if it was anything with respect to other meetings, we would be able to go back to our archives on the website to be able to access that. With respect to this is messaging amongst ourselves with respect to issues that are before us. So would it really make a difference after we've taken action on a particular vote, or before or after, that it would need to stay up there? Because if we are having our meetings archived, they're live. What would be the distinction between putting a time limitation, day limitation? I'm just curious.
I think there's some confusion. The message board is just about comments you guys are making, our staff is making. So it has nothing to do with actual board actions or anything like that. Okay, I wasn't sure.
I know that.
Okay,
But those are archived.
yes, it is.
Any other questions? Mr. Jones?
So if I use the telephone, I don't have to worry about this.
Correct. Correct.
Is that correct?
Yes, sir.
I agree with you, Board Member Jones. I'm old school too. Any other questions from any of the board members? All right. We'll end discussion. All in favor say aye. Aye. All against say no. Anybody abstaining? The vote passes.
Thank you, members.
Council, Mr. Giesland, Board, I have a request from Board Member Valdez, who's not feeling well today, to move executive session up and not bring Mr. Canola up yet. What do you think, Council?
It's up to you.
Board, may I do that? Okay, that way Board Member Valdez can go home. All right, so we're gonna go into executive session. Agenda items 5 and 6 will be taken in executive session, and they are, number 5, discuss and take appropriate action on the 1115 Medicaid waiver, delivery system reform incentive payment, DSRIP projects, the Community Care Collaborative, including healthcare delivery arrangements and other interrelated community partnerships. Item 6, discuss and take appropriate action on the update regarding Sendero Health Plans, Inc., including the effect of federal legislative and regulatory actions. It is 8:07, and I announce the board is convening an executive session to discuss agenda items 5 and 6 under section 551.085 of the Texas Government Code, deliberation of government board of certain providers of healthcare services. Thank you, everyone. So, take a 5-minute break, and then there is Ready? Okay. It is 8:47. The board will reconvene in open session. No action will be taken on items 5 or 6. Now, we're going to go back to, I know I said we were going to do it in order, but we're going to go back to items 3 and 4. Item 3 is receive a report of the July 2018 financial statements for Central Health. Mr. Jeff Canola will be presenting. The presentation is scheduled for 5 minutes. What's that? I didn't hear you, Jeff.
The other one.
3 and 4.
Would you like to take up item 4 also, and I'll just go into...
I think council would prefer that we separated them, so when the minutes would show that, Jeff. Sorry about that.
Oh, no, that's fine. It's fine. Oh, thank you. Okay. Okay, well, we do have some highlights. Let me read them to you real quick. This is July 2018, and they you should be able to see that in your handout. This is financial statements as of July 2018. We had a small intergovernmental transfer, $582,000. A year to date, our net property tax revenue is $181,000, which is 99.7% of our fiscal year 2018 budget, and we've collected 98.71% of our adjusted tax levy. I'm going to go through this pretty quick. You see comparative numbers for 2018 and 2017. This is our balance sheet as of July 31st. Current assets as of July 31st, 2018 are $113.9 million. Total non-current or restricted cash and investments is $62.4 million. Our capital assets are $116 million. Total assets on our balance sheet as of July 31st are $292.4 million. On the liability side, current liabilities are $11.4 million. Non-current liabilities are $8.4 million. Total liabilities of $19.9 million for 2018. And then you see our net assets, our unrestricted net assets, and our investment in capital assets. Our total net assets are $272.5 million. Total liabilities and net assets are $292.5 million. Onto our sources and uses. Again, the month of July is on the left. 10 months into the year, just for anyone that's doing a straight line calculation, that's at 83.3% of the year. Net property tax for the month was $254,000. Lease revenue was $858,000, and other revenue is $222,000, which you'll notice on our other revenue line, we're exceeding our budget through basically additional interest income. Uses of funds, total healthcare delivery for the month is $918,000. On our administrative program, we had expenses of $430,000, consisting of personnel, mainly personnel expenses of $324,000, legal consulting, and then just other general and admin. You see a small amount for tax collection expenses. Total uses are 1.3, almost $1.4 million for the month. Our sources of our uses decreased by a little over $16,000. Our healthcare delivery program, so this is detail. As I mentioned earlier, we had about a little over $582,000 that was done through an intergovernmental transfer. You see provider costs are actually negative for the year. This was mainly due to a anchor entity, IGT, that we received. And just as a reminder, when we incur expenses throughout the year, and when we're reimbursed for anchor expenses, we show that as a expense reimbursement. So that's why you'll see upon receipt of those monies, you'll see a negative number. Healthcare operating expenses were $530,000, and then other costs are $328,000. Total healthcare delivery is $918,000. And then this is just a recap of the small, again, we did about $582,000 of intergovernmental transfers. And they were mainly just some residual DESRA projects that had been carried forwards from the previous DESRA, can I call it phase 1, just through demonstration year 6. That concludes Central Health. Be glad to answer any questions.
Any questions? Lee?
On the IGT payments, we're almost 30 million under budget. How much before the end of the fiscal year do you think we'll be able to IGT up?
I don't, so right now.
What does your magic 8 ball say?
There's a lot of just guessing on what even the capacity is.
Yeah.
For just as a reminder, for fiscal year 18, there's a, what they're calling pre-final and then a final IGT. And so we have hopefully a meeting that we'll learn something more later next week.
It's just a lot of unused money.
Well, it is, but there's a lot of discussion on what's still left in fiscal year 18, and then again the subsequent lawsuits for 14 through 18 related to the settlements of that. So at some point we'll have to deal with it kind of how we've done it before, which is going back to our contingency reserve and looking at allocated versus unallocated, try to address that timing issue.
Okay.
So.
Thank you.
Any other questions, Board? No action will be taken at this time. Thank you, Mr. Bernardo. Agenda item 4, receive a report of the July 2018 financial statements for the Community Care Collaborative. Bernardo will be presenting this presentation scheduled for 5 minutes.
5 minutes, and there's no action required.
No action on this item.
Again, balance sheet, sources and uses, 10 months of activity. Total assets as of July 31st, $42.4 million. Made up primarily of cash and cash equivalents. Total liabilities of $26.8 million. A lot of that is related to accounts payable and accrued liabilities related to provider payments. Net assets of $15.6 million. Total liabilities and net assets of $42.4 million. Sources and uses, you see as it relates to our sources, Desert revenue is right at 102%. Member payments, we have $45 million of aggregate member payments between Central Health and Seton. Total sources, $117.4 million for year to date, at 75% of our budget. Healthcare delivery is at 69% of our budget at a little over $70 million. And then you see the UT Services Agreement payment at 100%. And then Desert project cost at $989,000. And again, we've changed the cycle of the Desert projects. We do expect to see additional cost incurred in fiscal year 18, but we're on a calendar year basis now, not a community care collaborative fiscal year basis. So we would expect to see some budget left in that amount, and then we'll have to adjust accordingly next year, our fiscal year 19 budget. Healthcare delivery cost, we're at 69%. of our $103.1 million, you see the service lines, with primary care, our biggest budget at 79% in the year. Detail of the 79% by provider, community care, our biggest providers at 81%. You do see volunteer clinic at 130%. And we know that's going to go over, and we'll address that in a subsequent presentation. Again, 79% of healthcare delivered costs related to primary care. Specialty care, you see the different service lines here. Our total year-to-date amount is $6.8 million. We're at 51% of our approved budget. You do see some lines here that are at zero, and they will more likely stay at zero for the remainder of the year, simply because we had anticipated getting those service lines up this year. It's more than likely going to happen in fiscal year 19. And then you also see a zero on our consultation and referral platform. And again, just as a reminder, we were proceeding down a path for a specialty referral system. We withdrew from that system. We're out again looking at requirements, and we're out on proposal to look at potential solutions for that platform. Operations, which are just our departmental budgets, we have an aggregate budget of $12.9 million. We're at $7.4 million, which is 57% of our budget. That concludes the presentation. Hopefully I made it in 5 minutes.
Thank you, Mr. Little. Remember this, there is no item, no action taken today. Sure.
Go back to slide 7.
I'm sorry, slide 7. Okay.
So, as we see these budgets for fiscal year 2018, that's
Mike.
Oh, sorry.
Sorry, yeah.
So, what happens to that amount that is left? Which pot does it go to?
So
Whatever unused monies in
it rolls into our contingency reserve, which rolls into our subsequent year. So we have a sources in the subsequent year that takes any balance left over, and it's included as a funding source for the subsequent year. So in fiscal year 19, you will see a line item, a source that's all of the ending balance that rolls into the subsequent year.
So typically with CCC, on average, how much do they roll in?
Well, they've been fairly substantial. For example, in fiscal year 18, we had if you look at this line item here on sources of funds where it says operations contingency carry forward, $13 million was rolled in from the previous year. So that would be from fiscal year 17.
And has that been the same historically?
As far as large amounts, yes, we have had amounts roll in prior years that have been, I don't know if I'm not sure what the right term is, larger amounts. Significant amounts, if that's, because we, again, as we tried to get specialty care off the ground, there were a lot of challenges that we had as far as trying to.
I perfectly do understand. So my thing is, as we're going through the budget, if we know, rather than allocating into a program that I know it's going to take a while to kick off, maybe allocating that additional funding to services that is needed. So that's just a different way of shifting the monies. Because personally, I feel there may be areas that we can invest more that is needed, and funds are.
I think we've tried to be really deliberate in
So just-
fiscal year 19 to be deliberate on something that, a service line that we can deliver on, and not to try to, be deliberate as far as the budget allocation for that service line. So I hear what you're saying. I think that we've learned over the last couple of years what some of our limitations are, and maybe what some of our more loftier aspirations were to get these service lines in place. I think through just experience over the last couple of years, I think as we move into 19, you'll see a much more correlating budget to the amount
actual.
of services that we actually are capable of delivering.
Well, thank you. I just also appreciate if you can also share that feedback with the CCC who creating the final budget.
Sure, I've already shared that repeatedly.
Okay, I just wanted to.
That we need to try to really look at right sizing on what we can
Yes,
deliver.
I know
And
we're
we've had
very
some,
ambitious to have all these services and it takes forever to kick off. But if we have allocated funding and we know that this program is not, we're not going to able to be kicking off due to unforeseen reasons, that money would preferably be inputted into other services that are currently in use.
and I think we've really tried to do more of a pilot process. I think you'll see in 19, just some smaller amounts that as we go into newer areas, we're looking at piloting, smaller amounts. I think some of our larger spends are spends that we've seen grow, like post-acute, for example, is an area that you've seen grow over the last couple of years. Again, we're trying to right-size that. Thank you.
Any other questions, board? Ms. Crowell, thank you. Agenda item 8 is confirm the next regular board meeting date, time, and location. The next Central Health Board of Managers meeting is scheduled for Wednesday, September 5th, 2018 at 5:45 p.m. or immediately following the second public hearing at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. The second public hearing is to be held on Wednesday, September the 5th, 2018 at 5:30 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. And with that, I'm ready to entertain a motion to adjourn the. Okay. I have a motion by Board Member Greenberg, seconded by Board Member Masifta. All in favor, say aye. Aye. All right, motion carries.
Thank you, members.
Thank you, members. Sorry about that.